Well, thank you very much, Marie, for inviting me to speak today. I'm not quite sure why you picked me, but I hope I do a good job. She asked me to come and give a practical talk. She said, a how-to talk. And honestly, I'm not sure if I'm the best person to give a how-to talk. There's so many great specialists out there in spiritual care. I've learned so much from my colleagues who are clinical chaplains and others about this subject. So what I'm going to talk about really is a practical approach to spiritual care from the perspective of a physician, and how I've come to develop a way to approach this subject with patients across many, many different backgrounds and faith beliefs, and just incorporate it into my regular practice. And I'm hoping that some of the insights and ideas that I've developed over the years may help some of you as well. So before I start, I want to just give a little story from my own professional life. And it's not that this is a great, insightful, deep story or event, but rather it triggered me to start on this path. And it's a very small thing that kind of reminds me of what's really important and keeps getting me back on the right path if I sort of veer off. So this happened about 32 years ago, a long time ago, when I was a medical student, a third-year medical student down in North Carolina. And as third-year medical students do, we do clinical rotations in different sites. So I was doing my clinical rotation in psychiatry, and I was taking care of this lovely, lovely elderly woman who had just been diagnosed with psychosis, a new onset of psychosis. And nobody could figure out why she had this. It's unusual to develop this type of psychosis this late in life. So she'd had the complete medical workup and now was on the psychiatry floor trying to have her medications adjusted. And the poor woman, she was anxious, worried, pacing all the time, could barely sleep, was having very disturbing hallucinations, and this was her life. And every day I would just go and chat with her. I was a mere medical student. I didn't know much, but I would go and chat with her and do what I could and talk to the family. And this went on for several days. Now my rotation ends. I was a medical student. I was there for a few weeks. My rotation ended. I said goodbye and then left and went to another hospital to do another rotation. About a month or so later, I returned. After that rotation finished, I returned back to the same hospital, but now on the medicine floor, internal medicine ward. And I was on the ward, and to my surprise, a little ways into my rotation, my patient was admitted to medicine, now having had a major stroke. So she was barely responsive. She was kind of just a shadow, of really what she was, the person she was. And my senior residents, really very minimally interacted with her at this point because in their mind there was nothing left to do. But I'd go in and see her, and then every day I'd just spend like 2 minutes, 1 minute, 2 minutes talking to the family every day. Now, again, my rotation ended, so I was saying goodbye to the family members. It's a brother and a sister. And I was turning away to leave. The sister put her hand on my arm and looked at into my eyes and said, "You must know the Lord as your Savior." Now, you must know the Lord as your Savior. Now, you have to remember, I am a Hindu in North Carolina, which is very Christian. I'm in my 20s, so I haven't really sorted much out yet. And I have to say, I basically went blah, 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 blah. I just didn't know what to how to respond. I didn't know, was she asking me if I was a Christian? Was she, what was she saying to me? And honestly, I did. I don't know quite what I said, but it was probably something like, I'm a Hindu. Actually, I'm a Hindu. And that's how it ended. And it wasn't a great way to end. And so reflecting on it later, I said, no, she wasn't asking me that at all. This is not what she was asking. She was expressing something. She was expressing gratitude for something that happened, something maybe that I did, I'm not sure. But there was something that happened that she identified as spiritual. And she used the language of spirituality that she knew to sort of identify that, right? So it was something that I did without knowing that I did. So I think that was my first thought of like, I did something I did provide a spiritual care. What was that? And that's what we're going to talk about a little bit today. As we talk about spiritual care, there's a lot of aspects to it, but the most fundamental aspect was something beyond words, because I never talked about anything, other than just being there. So it's the being there part. And is that the punchline? Okay, punchline. So let me start with a quote that I love about, to me, I don't know who wrote this and what they wrote it about exactly, but to me, this is what medicine is all about. It's not just about curing. It's to cure sometimes, to relieve often, and to comfort always. And I can tell you as a physician who's gone through medical training and now have done a lot of medical training, the cure is, talk about cure and biologic basis of disease is like the big chunk. Relieving, yes, we talk about that, chronic disease management and things like that. We never talk about comfort, like how do you provide comfort? It's like, it's a minimal piece. Yet that's the thing we're supposed to be doing always, right? So what is that and how do we do it? I'm going to start with a couple of cases. I'm going to run these through very fast, and it's mostly just to give you some things to think about as we go through the rest of the talk. So the first case, and I'm sorry it's busy, but I'll just give you in a nutshell. This is an 86-year-old woman who had an incidental finding of cirrhosis when she had a cholecystectomy, her gallbladder removed. She had never drunk in her life, so this was one of those unusual causes of cirrhosis. The specialists felt like this would never cause her any difficulty. About a year later, she started having some symptoms that were probably related to her liver disease, but had a very short hospital stay, went home. In the meantime, her husband got diagnosed with tongue cancer. They were both my patients. And it was a really, really tough year, a lot of chemo, a lot of treatments, but he got through that. They had decided not to be resuscitated in the event of if their heart and lungs, if they stopped breathing and their heart stopped, but they did want treatment for reversible conditions. A year later, she had another episode of this swelling that was probably related to her liver. She was again admitted, and the patient and the family expected a short hospital stay, as did all of us. She was alert, interactive, fine. But this hospital stay sort of dragged on. She got multiple complications. Her mental status, she was like in and out of awareness and consciousness. And so now we were faced with that dilemma. Should we keep doing all of these things, or should we start talking about not doing all of this? So, you walk into the room and put yourself in this situation as a clinician of any sort, or a friend, family member. You walk in the room, and husband is sort of standing at the window, kind of staring out of the window and thinking. And he first doesn't notice you coming in, but you stand next to him, and he notices. Says, "Oh, hi, Doc. I was just thinking, it's really hard to figure out. She's such a good woman." So what is he talking about? What's going on there? Case number 2. It's a young Muslim man with a new diagnosis of thyroid cancer. He's a new patient in the outpatient office, very smart, bright, graduate student, recently had a lump in his neck, a nodule had an evaluation, and it's thyroid cancer. At the last visit, he's been given the diagnosis, but he seemed to be having a lot of time digesting kind of this diagnosis and making a decision. A few days later, at the follow-up visit, you hope to get things started, treatment, but he's really reluctant to move forward. He seems troubled, kind of wonder if he's depressed, but he doesn't quite fit the depression criteria. He's not interested in counseling. So the dilemma is, he's unable to make decisions about his treatment plan. What do you want to know? What's going on? Case 3. This is a 28-year-old single mother with 2 children. One child has autism. She works as an EMT. She's a wonderful mother. This is someone I'd known for quite a few years, an incredible mother, incredible person, saving lives every day, very well put together person. But, things happen in life, and so recently she had an unplanned pregnancy and had decided to have an abortion. And I saw her at the time, around the time of the decision, and it was a very, very difficult decision for her. She made the decision and she was coming back for a follow-up. She just couldn't handle all of the things she had to handle. So at the follow-up visit, she's very, very tearful. She's emotionally fragile. And she says something to the effect, I gave the others a chance, why couldn't I have given this one a chance? So what do you want to know? What can you do? Last case is a 76-year-old female with probable ruptured appendix, which was walled off and abscessed. She was still spiking temperatures, and so she actually needed to have surgery in order to have this fixed. But she's not a good operative candidate. She's got lots of medical problems, so surgery would be very, very dangerous for her. She's otherwise really sharp as a tack, your grandmother type, kind of like, get around, do what she needs to do. You already know she's a devout Christian. She asks you to pray with her prior to surgery. Now, remember, so when I bring this case up to our residents and medical students, this is the one they go, to, because they're not, this is a different audience here, but for them, this is a tough question. So to try and sort of figure out how to approach all this, I want to give you a little bit of sort of framework or theoretical background, and I think it'll juxtapose nicely with what you've already heard today. I haven't heard all the talks, but hopefully you'll see some common themes as you go through. So the first thing is, I'm coming from the perspective of a healthcare professional in the United States. So how does spirituality fit with your vision of, or the current vision of healthcare? So in order to even talk about this spiritual care, spirituality as part of routine medical care, we have to have this idea that human beings are whole people. And coming after Father Seraphin's talk, I think you already believe all of this, but this is something you have to talk to, when you talk to other people, we have to think about. So we have to think of the human being as much more complex than the body. And I put body, mind, and spirit. This is how I label this, because it seems like a common language, but certainly I think from Father Seraphin's talk, you understand that this is much more complicated. There's so many layers. So the mind here is probably closer to the soul, and has those 3 layers that Father Seraphin talked about. From my theological background, there's actually 5 bodies. There's the body, lower mind, upper mind, lower like soul, and then spirit, which is very similar to the spirit that Father Seraphin was talking about. But for simplicity, I'm just going to write it like this. So here's a whole human being. Health is affected by things within that whole human being, and also external factors, cultural, families, environment, social factors. So what is the definition of spirituality that we can use across all these different people with all these different beliefs and all these different perspectives of life? So to try to get to that, I ended up asking about 800 people this same question in various small group teaching activities, did a literature review, did a qualitative study, and just asked What does the word spirituality mean to you? What is the human spirit? And how does spirituality relate to religion? Again, this is not just anybody, because every single medical student who rotated through got this session. So it's a very broad range of people. And what I found was it's actually really, really complicated in terms of how different people view this thing that we think is the human spirit. And it's helpful to kind of have an idea of these different views. So trying to sort of piece it together, I ended up organizing it in kind of 3 areas, and you'll see there's lots of overlap. Again, I'm really happy Father Seraphin spoke before me, because it's really nice to see how these things interdigitate across different writings and things. So the 3 dimensions, I organize it roughly into head, heart, and hands, and you've heard that in different settings. The cognitive or head aspect has to do with beliefs, values, ideals, meaning, purpose, truth. So these are almost that higher level of mind, or the higher level of the soul. How does the human being make sense of the world around them, right? So when it comes to health and illness, it's those big questions. Why do bad things happen to good people? Why? It's the Job question, right? It's the karma question. Why? What happens after I die? What happened before I was born? Is there a heaven? Is there a hell? Is there reincarnation? What's going on, right? So these big questions. And you can imagine that in healthcare, when someone's sick, even if they've never thought about these things before the whole life goes along, here they are in a hospital bed, lying there. These questions are going to come to the surface, whether you know it or not. You may not know it. It may be these deeper questions. All right. The heart. All right. This is the spirit. This is the spirit aspect. This has to do with love. It's love. It's the ability to give love, receive love. It's connection, relationships. The biggest and most important, of course, is that the relationship with the transcendent, but you can talk about it in terms of relationship with self, relationship to others, relationship to the environment. It's the source of inner strength, resilience, inner peace, comfort, support. Where does that hope come from when there is no hope? Right? So that is the heart aspect. And then the hands aspect, the behavioral, is what do you do? How do you act in this world? All right? So how does the head and the heart inform your decisions, your daily behaviors? In medicine, it has to do with, do you decide to continue chemotherapy indefinitely? Do you decide that it's time not to? Do you get coded? Do you not get coded? What decisions are you making? It also has to do with your specific practices, rituals, prayer, meditation, yoga, whatever it is that you're informed by. Does that make sense? So how does religion relate to spiritualities? That's another big question that I ask all these people across. And you'd be surprised. We get such a broad range of people's views on this. So you'll have some that say spirituality is here, religion is here. They're completely different. I am spiritual and not religious. And this is getting more common. So the spiritual and not religious thing. There's a lot of people who have that overlap. They're kind of overlapping issues, and somewhere in the middle is both. There's some that say spirituality is the big thing and religion is the smaller subset. And there's some people who just look at you. If you ask, they'll look at you cross-eyed, like, what are you talking about? It's the same thing. It's the same thing. Why are you even asking me? So again, the worldviews of people that you're interacting with are going to be very, very different. One way that I found useful is to go back to this and say, if these are our universal human spiritual concerns, then what religions do is give you a way to understand or make sense of these sort of questions that are beyond us, So each religion has given us a way to approach these unanswerable questions or these deep, deep needs. So when you ask what happens before I was born and what happens after I die, some religions will say that, heaven, hell, purgatory, those 10 things. Others will say karma, rebirth. This is this is what's happening. When you say, well, how do I feel connected? How do I feel that love? How do I feel one with the divine? Each religion will say, well, this is what you need to do. These are methods that we know will help you connect. And we'll give you some ideas, we'll give you some approaches. And then for behaviors, with those very, very, very difficult questions in terms of, so the abortion question, the end of life questions, each religion will have some guidance, a framework for us. So that's, I think, how you can think about it. If these are universal spiritual questions and needs, religions provide the language and a way to think about it. So I think about religions as different languages for a uniform human need. So now we're going to sort of step into, I took a while there because it is hard to sort of frame it. So now we have the healthcare provider and the patient in relationship here, in a therapeutic relationship. And this slide is to remind us that we've talked about that patient, with all of that. Well, we are the same. We are human beings. So we are coming and entering into a therapeutic relationship with all of those same issues, with all of those same questions, with all of those same needs. And some of our answers are going to be similar, and some of our answers are going to be different, but we do have the similar needs and questions. So in that therapeutic relationship, it's very easy to know what we do on a physical side. There's medication, surgery, physical therapy, etc. What's therapeutic at the mental health level is counseling, stress management, cognitive therapy, etc. So what is therapeutic on a spiritual level? And that's what we'll talk about. To understand that, just going back to that original question, curing really relates to the body, right? Cure illness. Relief can actually relate to all three of those levels. What are we relieving? We're relieving suffering, so physical suffering, mental suffering, spiritual suffering. What is comfort? Comfort is all about the spiritual, I think, that maybe some mental relief, health relief, but spiritual. So thinking about spiritual suffering and breaking that down, it helps to look at it in those three ways too: head, heart, and hands. So how is someone suffering with those big picture questions? Is there someone who is struggling with that meaning question? If you have an idea that that's maybe what's going on, you'll have an idea of what you might be able to do to help. Are they suffering at the heart level? Are they feeling isolated? Are they feeling cut off from their sources of support, their sources of strength, their sources of love? Are they feeling cut off from God? Are they not in relationship to God the way that they have previously been? Is there suffering happening there? And in a behavioral level, is there things that, maybe there's rituals and practices that they always do that help them, that they are not able to do lying there in that bed, in that isolated room. Maybe there's ways that there's suffering that's happening there. So when we look at spiritual suffering, we kind of have to keep those three things in mind and see where our patients are. So now we're going to just sort of transition to skills. You wanted a practical approach, sorry. So I'm going doctory. So what are the clinical skills? Well, there's assessment skills. That's diagnostic. So how can we figure out what's going on? Are spiritual factors helping or hindering the healing process for this particular patient? Then there's spiritual care, which is the therapeutic part, which is providing the relief and comfort. And we'll talk a little bit more about that. What's general spiritual care, what's more specific or specialized. And then a big skill, clinical skill, I put in here as the third element is you got to know yourself, really well. And you have to be able to care for yourself in order to care for others. And we'll talk about that some more. So, spiritual assessment, the diagnostic aspects. Well, there are many, many ways, and many of you may already be familiar, but there's many ways to assess someone's spiritual needs in the clinical setting. I kind of divide these into two ways. There's unstructured spiritual assessment, and there's structured approaches. I prefer the unstructured, which is just really listening, just listening to people's stories and recognizing the themes. So if you have that model, well, there's the head, heart, and hands themes. As you're talking to someone, those themes are going to pop up, and as they pop up, you can ask the appropriate questions and then sort of go from there. I like that. It's much more organic, but the structured spiritual health assessment is good because it gives you a plan, so there's several models out there. The HOPE questions I developed years ago because I was teaching a lot of medical students and residents, and it was just nice to have some sort of a path or some sort of a roadmap for them, and I'll share that with you as well. Before you can even do any assessment, there's something more fundamental. So all the words, you can ask any question you want. If it's not asked in the right way and it's not asked in the right context, people are not going to tell you anything. And I'm sure you've encountered that before. There has to be trust. So before you even before anyone can get anywhere, there has to be a good therapeutic relationship, a trusting relationship. There has to be appropriate timing, and again, that self-understanding, self-care comes about. Timing, I'm not going to spend a lot of time here, but timing is important. Maslow's hierarchy of needs, I throw out there. If someone is having excruciating pain, that's not the time to talk about their existential crisis. You have to take care of the pain. You have to take care of those lower levels of suffering before you can really even approach the higher levels. So just being aware of that is important. I often just ask, as part of my exploration of people's support systems, just to get a sense of who they are. So as a family doc, I know people over time. So over time, I just at least know kind of how important things are to them, and then later, if needed, we can go in more depth. And the more in-depth discussions tends to come with those more serious, either emotional, physical kind of crises. In the unstructured, again, I was talking about those themes, right? So in the head, how are they thinking? What are their beliefs about suffering, illness, and death? What is the meaning narrative that they're making of this illness? Why did this happen? How are they feeling? Are they feeling connected? Are they feeling loved? Are they feeling at peace? How do they take care of themselves spiritually? What are their sources of strength and support? And hands, how do their beliefs and values and state of being influence their response to illness, suffering, and death? So sometimes the cue here is if someone is behaving or acting in a way that doesn't quite make sense, there's distress that outweighs, it's larger than you would expect, or the response is different than you expect. There may be all kinds of reasons, but one could be a spiritual reason. So that's one of the cues that makes me look a little bit deeper when someone's not responding or acting quite the way I would expect them to in a certain circumstance. And how do they view you? That's another, what is your role in their life? It can be kind of interesting, especially for surgeons, I think, because a lot of people put their whole faith in their surgeon, and sometimes it's a big burden to bear. So actually, I just went over those things, so that thinking about these different aspects. So these are some of the specific questions on that hope, that structured one that I talked to you about. So the hope questions, H stands for sources of hope, meaning, comfort, strength, peace, love, and connection. O is about organized religion, the role for the patient. P is personal spirituality and practices. And E is effects on medical care and end-of-life issues. So these are some sample questions. It's intended purely as a clinical tool and just to give some ideas. So there's absolutely no reason to use the exact questions. But one way I have found that's very helpful to approach a discussion is to start from that support systems, as I talked about. You're going through a very difficult time right now. How do you, what are your supports? Who supports you as you go through this? So that usually gets to family and friends. But then you can say, well, when they're not around, where do you get your strength from? Is there? I mean, that's the question really. Is there any other way that they are able to get hope and strength? That'll give you a sense of, their ability to go forward. So if they have no friends and family, and they also have no source of inner strength and support, this is, it's a hard situation to be in. Another question, there's a lot going on right now. How are you making sense of things? That gets to the meaning question without asking the meaning question. So the next set of questions go into the organized religion and personal spirituality and practices. And so this is really a tricky transition. So I start with those questions because those are the general spiritual questions. So you really can't offend too many people with those kind of very general questions. But when you then try to sort of step into religion and spirituality, you don't know the person in front of you really. You don't really know how they're going to respond. So I found that you just start with a nice general normalizing statement. For some people, their religious or spiritual beliefs help them during difficult times. Is this true for you? So this gives people the opportunity to say yes or no. So if it's yes, great, then you can start doing follow-up questions. If it's no, then you can stop here. But what I found is it's how the no is said, So if it's like, no way, no way, then it's actually a really great opportunity to ask. So you might just say, well, it sounds like there's a story there. There's something, and you may actually get this really rich story of people for whom religion may have been extremely important at one point, but who have lost faith, who have felt separation. They are suffering. Are they ready? That's that's why you're having the conversation. Do they need help? Are they willing to accept help? But the no is actually great. If it's like no, then it's all right. Just carry on. So think about the no. In terms of organized religion, you can ask any number of different questions because you've already said that intro. So these are just examples. But again, this is America. There's lots of diversity out there. So are you part of an organized religion? How important is it to you? What aspects of the religion are important and are helpful and not so helpful? Are you part of a spiritual community? Does this help you? How does it help you? How much you ask, how little you ask, really depends on how the conversation goes. Then we go on to personal spirituality. So here's where you might end up getting the people who are not spiritual, not religious kind of thing. So, do you have personal spiritual beliefs that are independent of a organized religion? What are they? Is there anything I can do to help you in that way? Here's where you can perhaps get to the relationship that people have with God. What is your relationship with God? Do you believe in God? What is your relationship with God? And this is, I think, probably the most important part here is what are the practices that help you personally, and is there anything we can do to help you connect with those? And I put all of these different pictures here because people are so individual, even within a religion, there's such a variety, right? So you have the individual practices, the meditation or prayer. There are the group activities. There's formal, there's informal, and everybody has something different that works for them. So it's just helpful to keep an eye on that variety. And then the last set of questions are really honing back down to, why is it pertinent? Is it, I'm a doctor here or a nurse or a social worker. We're in a healthcare setting. How do these things, how can we support you? So all of these questions are trying to get at that. So we've gone past the assessment piece now. Are you with me still? You're falling asleep? Okay. All right. So now we're moving on to that second skill, which is, well, what do you do about it? Okay. And this is a big question that our residents and medical students want to know. Is like, well, or the practicing physicians is like, what's the point of opening that can of worms if we can't really do anything about it? Because healthcare professionals are do, run. So we have to actually give people some sort of tools or some approaches. So what's helpful is to sort of break this down into those two general categories I talked to you about: general spiritual care and specialized or specific spiritual care. The general really addresses some of that heart issue, which is the connection piece. This is something everybody can do, and we'll talk about that. Specialized or specific spiritual care addresses the head and maybe the hand issues, and this is really for the most part should be left to people with special training in these areas. And so one of the things we have to be aware of is what can each of us do and what really we shouldn't be doing, because it's a specialty area, it's complex, and there are people who know how to sort of delve into that, and there are people who don't, who lack training. So I tread very lightly there. I usually don't go in there. I'm a physician. I am not a trained spiritual care provider. So general spiritual care, this is about that comfort always. It's about being a healer, bringing healing to your encounters with patients. Recognizing and tending the spirit of another, providing compassion, presence, real listening, and I say real listening versus that halfway listening as you're walking out the door, and encouraging realistic hope. So what we can do just in verbal and nonverbal ways to support that person. It's true patient-centered because it's all about them. And it can be given by anyone who has concern and compassion for the patient. You never need to even bring up the word spirituality. You don't have to ask any of those questions that I just listed before. And it takes no extra time. Okay, so spiritual care, general spiritual care, this comfort always happens while you are doing everything. It is the hardest thing to do because it takes us being present. You can run around and ask 100 questions. You can run around, draw blood, and do this and that. But are you present? It's the hardest thing to do. It is the most important thing to do. It is what that sister of that patient, I think, recognized that I did accidentally, I think, was be present with them, even if it was for a minute or 2 minutes or whatever it was. Okay, so I want to stay here. If you take one thing away, spiritual care is about this. So the compassion. I just did a couple of slides on this because there's some great things. So compassion, again, I'm preaching to the choir here. You guys, we talk about this all the time, but I love the idea that compassion is active, it's a verb. It is not just, I'm compassionate. No, it is something you're doing. And it's recognizing that suffering and being moved to help. It's an active process. compassion, this active process, is that ideal is present in every single religion. It is human. The golden rule, do unto others as you'll have them do unto you, it's embedded. It's embedded because it's human. And it's embedded because, in my opinion, it is God's connection with us. It's God acting through us. So the path of action is a great part. You all know Mother Teresa. She's love in action, right? Not just love, love in action. Karma yoga in Hinduism, the path of action. Action in Hinduism, it can be done in both the love mode, or bhakti, a devotional mode, or in a duty type of mode. It's in the bhakti mode, in the mode of love, that karma yoga has that sort of full kind of expression of compassion. One note about compassion versus emotional entanglement, and again, this comes out of training students, residents, faculty, is that often helping people confuse this kind of compassion that I'm talking about, that's driven by the spirit, driven from that pace of spirituality, with the emotional need to help that comes more from that lower mind, the mind of the lower aspects of the mind, where there's danger, that your mind is getting all emotionally entangled. The way I think about it is the image of quicksand, right? Someone's in quicksand and sinking in quicksand. The compassionate person will be moved to help, right? Will find a way to get that person out of the quicksand, but stay on solid ground, right? The emotionally entangled person jumps into the quicksand. So you're there, your emotion, you're feeling it, you're sinking, they're sinking, nothing is good is coming out of this. So the compassionate person understands that difference, and can move and not confuse it with emotion. Does that make sense? It's hard. So compassionate care, I think I already said that. It's recognizing suffering, being moved to help. It's how you deliver care. You give presence, patience, understanding, caring, true listening, supporting realistic hope, truth-telling. I put truth-telling there because that is actually a key thing for us, in my role as a physician, that I have to do a lot. So, knowing, I think patients come to doctors for guidance and help, and being able to tell the truth is sometimes a very, very hard thing when the truth is hard to deliver. You have widely metastatic cancer. Prognosis seems to be this. Doing that in a compassionate way, in a truthful way, is hard. It's so important. So radiating compassion, a therapeutic tool. I love this picture just because there's something about her face, it's just lovely. So a quick note on the specific or specialized care. There may be a few straightforward things that a physician or a nurse or social worker can do just to make things a little bit easier for someone having figured out, having discussions. But the complex issues, as I've talked about before, need a trained specialist. And knowing who the trained specialists are around, the clinically trained chaplains, CPE trained chaplains, members of people's own religious groups that can help and provide guidance. If you're entering this, we should know who's around and how to access the right help for the right person. And don't go in and do it yourself if you've never been trained, because this is really hard. So what can the doctor do? Just a quick note on this is the do no more. And this sort of goes back to that original story where my senior residents there barely went into that room with that patient, because what can we do? There's nothing to do. But actually, the do, I hope I've convinced you, the do is just being there, just going in and sitting, and finding a way to go and sit is the doing. Adjuvant preventive care, this is like the terms that we use, but helping patients identify their own resources and mobilize their own resources. So whatever that is there a way that we can help them find that out, figure that out? Modify the treatment plan. There may be reasons to modify the treatment plan based on what you have learnt through your discussions. Maybe they need a referral to a clinical chaplain. Maybe they need to stop aggressive therapy. Maybe they need to reconnect with their own cultural community. Maybe they're willing to learn simple relaxation or meditation techniques that would help them. So now, going back to that picture, I love pictures, sorry, I'm a picture person. But at the top there, now we have the spiritual counseling, which is a therapeutic intervention. And I would say that's it's actually, if you want to divide the spirit or have that say, actually that's the upper part of the mind or the upper part of the soul, the counseling is sort of dealing with that cognitive aspect, but the compassion, presence, and connection is trying to make a connection on a deeper level. So now I'm going to move a little bit, and I've alluded to this before, but this is this third main skill set is the self-understanding and self-care aspects, spiritual self-understanding and self-care. Self-understanding, hugely important, especially if we're talking across cultures or across religious beliefs. It helps us stay patient-centered. Do I understand myself? Do I understand what's okay with me, what's not okay with me, how I want to approach my work? It also helps us prepare for our whatever difficult situations are most difficult for us. That last case, which is having someone ask you to pray, is the example that all the studies that I've done interviewing residents and medical students about what are you most worried about? Well, I don't know what I'll do if someone asks me to pray with them. I don't know what I'll do if they ask me what I believe. That is a big issue for some people. Not for others, but for some. So you have to know what it is that would be difficult for you. Self-care helps maintain our ability to provide that compassionate care, which is the hardest thing to do, but the most powerful thing to do. So we are humans, we are spiritual beings too, and so we have all of these aspects. So how are we thinking? How do our beliefs regarding suffering, illness, and death impact the way we approach our work? What are our ideals, values, and sense of purpose? Why do we do what we do? What are our biases? What are our barriers to being patient-centered? How are we feeling? Are we feeling centered, connected to the divine, connected to ourselves? How do we take care of ourselves while we take care of others? What are our sources of hope, strength, peace, support? What are our specific practices? What rejuvenates us? And how does this affect medical care we provide? Again, I'm talking in the medical setting. What's our response to illness, death, and dying? Is it something to be avoided? Is it something to understand? What is our approach to abortion? What happens if we encounter that? How do we view our patients? How do we view ourselves? How do we avoid burnout in this setting? So now I'm going to switch to another little aspect. Now we could spend probably a whole lecture on ethics and boundaries issues. Okay, and I only have a few minutes, so I'm going to move a little faster. But ethics and boundaries, there are boundaries to patient-centeredness. There's boundaries to role and training. This sort of goes back to what we were talking about earlier. Okay. I want to send a few slides very fast now because I have a few minutes to go over cultural considerations. Navigating the difference between different belief systems and cultures. So one of the things we have to do is just clarify patients' beliefs and family beliefs, and that's through respectful listening. Look for common ground, common goals, and place the patient's needs of primary importance. And I think a note here is that it's impossible to know everything, so the one take-home point here is humility, that all we have to do is ask, and people are very happy. If you ask in a genuine way, people are happy to share. Another thing that's very helpful for me is to think about how different people view the transcendent and what that relationship is with them. They have very different views of the role of God or existence of God even. So here is the picture that I already showed you. And this is the humanistic or atheist model. We could put meditation and prayer in here, but it's also within the individual. So an atheist or humanist would say prayer helps, meditation helps, but it's all within the individual. There's nothing beyond that. This is the duality model where there is a belief in God or a higher power that is separate but very, very connected. So here God is seen as the father or the mother. The individuals are brothers and sisters. We communicate with God through meditation and prayer. When we help, when we provide compassionate care, we are sort of channeling God. It's God that's providing, and we are just opening the door for God. So through God is how healing is happening. So that what you're doing in that compassionate care is not you, it's you channel, it's God working through you. So this is God in the cosmic consciousness model or the mystic traditions, or the unity model, I call it. So here the triangles are upside down, and the body is just the tip of the iceberg. The spirit, at the spirit level, we're all connected. So our relationship to God is not mother-father, but rather we are part of God. Our spirit is part of the greater spirit. We are a wave on the ocean, a ray of the sun. Okay. The thing I want to point out is that relationship, or the therapeutic relationship at all of those levels, is actually exactly the same. So it actually doesn't matter what model someone else has in their head. It's your view, because ultimately that's your strength or your source of strength. But the relationship is the same, and what you do is the same. Does that make sense? Okay. Quick note on spiritual self-care, do it. I was going to do an exercise, but I would like you to actually jot down for yourself, what you would do, what do you do to keep yourself connected and grounded and in constant contact, I suppose, with the divine. If that is your belief, how do you do that, and then how do you bring it into your work? These last slides, I'm not, well, how many minutes do I have? 1 minute. I'm not going to go through these because these were just lovely quotes from a couple of studies I did, and these are quotes from students and residents and faculty, practicing physicians, about facilitators for compassion, and I think you guys can figure it out for yourself. But some beautiful quotes, and if you guys want these slides to see them, you can. I like this last one, how to increase compassionate care. Take a minute and look out the window, stop what you're doing and enjoy the sunset. Say some type of self-affirmation when you're washing your hands before you go see the patient. Take a deep breath before you go into a room. So just quick things you can incorporate into your day. Figure out what it is for you so that you can bring your presence to your patients. So these very last cases are very, very quick. That first one with the patient who was approaching end of life, the issue he was asking when he said, she's a really wonderful woman, it was the meaning question, right? Why is the innocent suffering question? She did everything right, why is she suffering? And this is someone that we ended up having the conversation and transitioning to hospice, but that was a trigger for the conversation. The second case of the young Muslim man, this is a person whose whole family was in Jordan. He had no friends. He was completely cut off from his community, a very devout Muslim, and didn't really have that grounding that he needed. And what we needed to do was connect him to his community and then have them help him figure out what his next steps would be. And he was worried, he hadn't been going to mosque, he hadn't been doing all his usual prayers, so was God angry at him? There was all these things that he was suffering with. The case 3 with the single mom and the abortion issue. This was, she was a Catholic, she lived in Rhode Island her whole life, and she had gone through this really difficult decision and thought she had made the right decision for herself, but was living with this guilt, that this was not in keeping with her church. And so, what we just talked about, it was an informal discussion. She needed more, but the start was, what was her view of God? And her view was a forgiving and loving God. So I just asked her, has God forgiven you? And she said, yes. I said, okay, so we're now at the point of you forgiving yourself. And so that's where I stopped, because I'm not a trained counselor, spiritual counselor, and we did refer her for some spiritual counseling. And the last one, the response to prayer. Again, you guys will have one, but keep in mind the different types of prayer, right? So are you comfortable with praying with people with your own religious faith? Are you comfortable if the prayers are from another religious faith? Are you comfortable just being present? Are you not comfortable at all? What is your level of comfort and what's okay with you? If you're not prepared, then it's a tough thing. That's it. I did sort of finish on time, sorry. Thank you.